5.3 million Americans of all ages have dementia. 5.1 million age 65 years or older have dementia. 200,000 under the age of 65 years have earlier onset dementia. There are 5 different types of dementia that we typically see. The diagnosis is made by a neuropsychologist as well as a physician or neurologist. We believe that it's possible to age gracefully and fight dementia. We have hope seen by neurocognitive training and early diagnosis that this is a disease that can be fought. There are different symptoms that are seen with different dementias. Alzheimer's dementia hits in the 50s and the 60s. It has a progressive life of its own. There's a small percentage of the real Alzheimer's disorder that actually exists. It begins with memory difficulties, there's a root finding, getting lost in familiar places, and progresses very, very rapidly with memory deterioration. Frontal lobe dementia begins with psychotic thinking, hallucinations, delusions, extreme emotional behavior that is out of character for the individual. There's poor judgment, poor decision making, and not abiding by the rules. Lewy body dementia tends to be the precursor for Parkinson's disease, and it's seen with initial problems in visual perceptual processing and psychotic thinking. Again, those delusions and hallucinations. Frontal temporal cardiovascular dementia results in the loss of memory as well as executive reasoning deficits, impacted judgment, personality changes, and you'll see that with stroke patients. What are the dementia risk factors? Heart disease, hypertension, diabetes, obesity, an unhealthy diet, smoking. A lack of physical activity is a very important issue. Depression, poor eating, poor sleep, death of a spouse. Traumatic brain injury, diffuse axonal injury that changes cellular changes in the brain. Cognitive inactivity, if you're not using your brain, it gets worse. There's a theory called cognitive reserve. People who use their brain fare better, and people who have more education do better. Sleep disorders is a dementia risk factor. Sleep apnea, insomnia, and of course, poor sleep hygiene. When do you diagnose dementia? When you have everyday memory problems that you're noticing or someone else is noticing. Forgetting things. Appointments are forgotten, cooking problems, conversations. There's this continual loss of items that are important. Getting lost and disoriented in familiar places, unable to make decisions, becoming more irrational and moody, accusing people of taking things. Actions occur without rhyme or reason and are unpredictable by those who love you. When do you diagnose? When these memory problems become more often are seen, and you really want to diagnose people as soon as possible for prevention to occur. So when you see these problems more often, that's the time. Diagnosis and treatment is made using neuropsychological evaluation, paper and pencil tests to address the brain. Memory, attention, visual, perceptual, and executive reasoning are measured using neuropsychological evaluation. Neuropsychological evaluation is used to then plan out a treatment program. Specific deficits are identified, and the treatment is based upon those deficits. Neurocognitive training has been shown to be very successful in bringing back memory. We see this in the research and also in the testing in this facility. So in our facility, we are seeing differences in the testing before treatment and after treatment, and it tells us that neurocognitive training is making a difference. We need to watch the sleep. Watch for sleep apnea, snoring, daytime sleepiness, too many afternoon naps. Address the sleep hygiene. Somebody's falling asleep at 7 o'clock in the evening and then waking up at 2 o'clock. You want to try and stay active later on in the day. Go for an evening walk. Dementia means taking action, not being afraid. The goal is to age gracefully in your own home. The key is early diagnosis and specialized treatment. Neuropsychological evaluation should be done on a yearly basis. Coordinated care between the neuropsychologist and the physician should occur, and the belief that dementia can be fought and that success is possible.